If there's something that characterizes pregnancy, it's the absence of menstruation. In fact, many women discover that they might be pregnant after realizing they have a missed or delayed period, without noticing any other symptoms. But there are situations in which bleeding can occur while the baby is developing in the womb. Some bleeding can closely resemble a period, while others are quite different. In this AllForBabies video, we will clarify whether it's possible or not to have your period while being pregnant. Can I have my period while being pregnant? The answer is no. It's not possible to be pregnant and have your period at the same time, as both options are incompatible. What you might experience is bleeding, but none of it will be your period. Instead, it will be caused by other factors, some of which might not be important, while others might carry risks. Therefore, if you're pregnant, you cannot have your period, and if you have your period, pregnancy cannot exist. They are completely opposite. In the next section, we'll explain the most common causes of bleeding during pregnancy. What causes the bleeding? As we explained before, if you're bleeding, it's due to a different reason than your period. So, if you're facing heavy bleeding, it requires an urgent visit to the hospital, as it can sometimes be dangerous for both the baby's and the mother's lives. Here are the most frequent causes of bleeding during gestation. Implantation bleeding occurs during the first month, being lighter than a period and lasting a very short time, between 1 and 3 days. Vaginal trauma. Sometimes bleeding can be caused by any friction, after sexual intercourse, or after a vaginal medical examination, as the area might be more irritated than usual. Hormonal imbalance. Hormonal changes characteristic of pregnancy can lead to minor, insignificant bleeding. Miscarriage. In this case, you would feel pain caused by uterine contractions, accompanied by intense red bleeding with the possible complete or partial expulsion of the embryo. Ectopic pregnancy. This means that the egg hasn't implanted in the uterus as normal, but is located elsewhere, such as in a fallopian tube. This pregnancy is incompatible with life, and the mother's life might also be compromised if not treated in time. It comes with strong abdominal pain, irregular vaginal bleeding, and typical pregnancy symptoms like nausea or breast sensitivity. Placenta previa. This happens when the placenta partially or completely obstructs the cervix, potentially causing severe bleeding. Infection. Infections during pregnancy can sometimes trigger contractions in the uterus that might lead to minor bleeding. Changes in the cervix. If you're in the final stages of pregnancy, the cervix can change to prepare for labor. In case of any bleeding that occurs during pregnancy, it's best to visit a doctor to avoid risks and prevent possible complications. We hope we've been helpful. If so, don't forget to give us a thumbs up and share your thoughts in the comments section. See you in the next AllForBabies video.